Hi, I'm Dara from Belly Bootcamp, and I'm here today with Jessie Mundell, who is a pretty prolific mama trainer and someone that I follow and find very inspiring. Jessie is in Alberta, where it's, like minus 25 right now in October?
Not yet. We'll get there soon enough.
So you'll be there before we even hit zero.
Yeah.
And Jessie is also a mom. And how old is your daughter, Jessie?
She's just over 2 now.
And you also train moms yourself. Or sorry, you train moms and you train trainers to train moms, which is where your business has gone recently, correct?
Yes, exactly.
And if people want to find you, Jessie, where's the best place for them to find you after this talk? Where should we send people to find you on the web?
Yeah, JessieMundell.com is the best place, and everything is kind of hosted there and can redirect you into different avenues.
Awesome. And you're at Jessie Mundell on all the social media stuff too, right?
Yeah,
Okay.
Facebook and Instagram is kind of where I hang out the most.
So Jessie is going to talk to me today about C-section, and Jessie's really nice to come and talk to me about it because you have a personal story about cesarean section, and then of course you coach women and you coach trainers around healing from a cesarean section. So you can kind of come at this from a few different angles, which I think is super, super valuable. So can you tell me first what you imagined your birth would be like, in a nutshell before the big day actually came?
Yes. Oh my gosh. I've written about this, talked about it quite a lot. But it actually took me a while to be able to talk about because the whole process, the whole experience was quite traumatic for me in the early part, postpartum, like first 6 weeks. I couldn't even think about the birth experience, labor experience. I couldn't talk about it without just losing it and crying. It was just so different than I was expecting and hoping for. So we had planned for a home birth. We were with midwives, had a doula. I just felt like that is how I envisioned things. And I felt really supportive in the idea of that being the reality. So after laboring for 30 hours at home, we needed to go to the hospital. We needed to transfer immediately. And even during that period and the whole labor leading up to it, I was not nervous. It wasn't stressful for me. I felt just quite calm, and I was open to things going however they needed to go during the birth. But I think I did birth box myself a little bit in terms of thinking that being at home, being with the midwives, doula, my husband at home was the way that was best.
Yeah.
And so when it did not go that way, when we needed to transfer, we got to the hospital. Baby's heart rate was irregular, dropping after every contraction. They thought there was meconium. We eventually moved to C-section. C-section was really beautiful as well. I felt super supported in the OR. We just had a great experience, actually. I think as best experience as possible with an emergency C-section that did have some scary moments, absolutely.
Yeah.
But again, it didn't really feel scary to me until we got home, until afterwards. And I thought back into certain moments during labor and leading up to the C-section that things just freaked me out a little bit and felt quite traumatic. So I'm more experienced post-traumatic stress disorder, not postpartum depression or postpartum anxiety, which can be so common. My experience was more flashbacks and thinking about these specific moments in the labor leading up to the OR that just made me feel like very scared, very out of control. So yeah, it was a little bit different than I was expecting even my reaction to be, because during the whole experience, I just felt really calm with things. And that's what people kept telling me during and afterwards.
Yeah.
Oh, like you handled that beautifully.
So calm, yeah.
And I felt like I did too. But then after, I was like hit by a truck with this flood of emotions that came through.
Are those moments of life and death in any kind of labor where you're like, I might die right now? I mean, I'm sorry, pregnant moms who haven't given birth yet, but you have those moments. And when I had my third, when she was born, I remember I was like, it's over. And they were at home, but I was like, it's over. And I realized I thought I was going to die. I thought I was going to die. And I was like, I'm not dead. When moms come to our classes with cesarean section, a lot of the time when they do come out and talk about it right away, they talk about it in really negative feelings. And that's obviously something I think that a lot of moms can share in because their C-section rate is so high, but it's almost like they're ashamed sometimes to say, oh, I couldn't do it vaginally, or I couldn't have her at home, or whatever it is. So can you talk to me a little bit about that? Do you find there's a stigma around cesarean section?
Mm-hmm. Yeah, absolutely. And you know what? I felt it myself too. I remember being in not the recovery room, but when we went to our room afterwards, and thinking, I'm going to have to tell this story. And are people going to trust me to coach them during pregnancy and afterwards? These were some of my first thoughts, which is so wild thinking back on.
Yeah.
And also because I coach so many moms that have C-sections.
Because I can totally imagine that. It's so stressful, right?
Yeah, completely. Yeah. So, yeah, and I coach so many moms with C-sections and proud of them regardless of how birth goes. And so it was just so interesting that those were the thoughts that I was having on myself. Yeah. And I think that that's so common for a lot of moms to put so much pressure on themselves. The other thing that I did during pregnancy, I was preparing. I was doing all the right things to prevent a C-section. Yeah. And just the mindset of that, I think, is so dangerous in itself, too.
That's such a good point, yeah.
So when I was doing all the right things and they didn't pan out, then what did I do wrong? What did my body do wrong? There was just a lot of confusion and mixed emotion about it. Mm-hmm. So I think that that can be absolutely a common experience for moms and something that is just so normal to process through and hopefully to get to the other side of and look back on believing that the universe gave you this birth for whatever reason, and it's totally fine and a beautiful way to give birth by having a C-section.
What's the typical care then, for those who don't know? What's the typical care and like post-op care for someone who has a C-section these days, at least in the Canadian system?
Mm-hmm. Yeah, so it's basically not much. I don't even know if they told me anything. I don't really remember, which is interesting in itself. But it was don't drive for 6 weeks, don't lift anything heavier than baby, right. And that's everything. No referral to pelvic floor, pelvic health physio, no guidance on how we returned to being was lifting more weight, moving the body more. It's simply just like, good luck.
Wow. And do they send you even with like tip sheets or something? Like, is there anything? Is there any follow-up? Like,
there really wasn't. There really wasn't anything.
Nothing like that, right?
No
knowledge source, no info source.
Mm-mm.
What is the protocol for healing? Is there any follow-up? Do you go back in for a checkup, or is it just 6 weeks and you're done?
Yeah, so this is crazy for me to look back on now, too, because Steele was born at 8 in the morning on Tuesday, and we left the hospital Wednesday afternoon to go home.
Wow.
And you know what? No one even offered or suggested a wheelchair. Like, I walked myself out of the hospital.
That's like, crazy.
Hello?
That's crazy.
It is crazy. And you know what? That C-section recovery, I thought it sucked so bad. Like, it was a lot of pain. It was so much discomfort. Yeah. Just very difficult with a newborn to get, like, to ever feel comfortable, to ever be able to rest comfortably. So I thought it was very hard. For some of my clients, I know they go into the doctor on those early days to check in with baby. Mm-hmm. And then at 2 weeks, maybe doctor will look at C-section scar. But often I think it really is just you check in at 6 weeks and that's about it.
Particularly if they're not giving any indication that it is an urgent situation or something you really need to pay attention to, then aren't you going to tend to be distracted by the first few weeks of crazy new motherhood? And then probably minimize your symptoms, which is a pretty typical female thing to do anyways, when you're afraid to go in and the doctor's going to say, this is normal, shut up, go home.
So I think just even more rest than you possibly think you need, more rest than you are doing right now, even if you're resting a ton, it's probably not enough. And then a protocol to getting back into more movement in a bit more of a structured manner. The advice that to wait that 6 weeks, do nothing, get the all clear from your doctor, go back to exercise, I think is so dangerous. I know you agree with that as well. Mm-hmm. But even more so than that, let's get doing some more things in that early 6 week postpartum time frame to just help the body feel a little bit better. And that is going to help the recovery process from surgery as well. So I think we have to rest hard and then start getting back into some gentle movement to help moms feel a bit less creaky and achy in their bodies.
Do you think 6 weeks is a reasonable healing time for a cesarean section, or do you think that's too short to give someone the okay to return to regular life?
Yeah, so this is an interesting question. I think that the healing process after such major surgery is so much longer. It just is. It might look healed from the surface, but below the layers, it's just such an intense procedure. I always recommend that my C-section mamas watch YouTube videos of C-section surgery so they can understand what's happening, what has happened to their bodies, because you will never approach a recovery of C-section the same way if you actually know what happens. Yeah, I wish I could see video of what mine looked like, because I just think that would be so cool. What is so tricky though is that, you know what, most moms just have to go back to regular life. And I can't imagine with newborn and then toddler or other older kids too, you just do not have the downtime or the rest time. So you just have to get back into it. So many moms, even the don't drive for 6 weeks is laughable to them, because that can't happen in their life.
Especially if you've already got a kid, right? But I think that the breastfeeding and healing guidelines in postpartum often are related to the economy's recommendations for mat leave. But 6 weeks for healing and 6 weeks is, the lowest end for mat leave in the States. Same thing, like the recommendations of breastfeeding in Canada being 1 year and mat leave is 1 year. I always think like there's this weird bureaucratic thing that has nothing to do with women's wellness or like postpartum wellness or kids' wellness, and everything to do with making it seem like your policies are legit. So if you're going to tell a woman she has to go back to work at 6 weeks, then you can't very well tell her that she's not healed yet, right?
Yeah.
So that's a whole other website I have to start, but what would you do again for your next cesarean, if it were to happen again, to optimize your own healing?
Yeah, that's a great question. So things that I did early on that I thought were helpful were some compression. So I did the SRC recovery shorts postpartum, and they felt good on my body. I know a lot of my clients do the C panty, which they really love too. So it's just some compression over the pelvis, over the incision. Biggie, once we get a little bit further out postpartum, say 4, 5, 6 weeks, is doing some mobilization and scar massage. Right. A lot of people get really freaked out by that, to be honest with you. Even touching it is just a strange sensation. I think it's a lot of emotional stuff happening there too. But that can be so helpful for getting good function back into those tissues, working through some adhesions, just making sure the tissue is moving properly. That absolutely will impact pelvic health. And then a biggie that I know you probably talk about with your clients too is just allowing the belly and that lower abdomen to relax. I think it can be instinct to try to protect it, because it does feel just so strange. You just had this big surgery happen. But if you can not do that, if you can just allow relaxation and your abdominal muscles to chill out, that's going to be super helpful to that healing process as well.
That's great. That's so helpful. When would I know that I was fully healed? Like, what should I not be seeing anymore?
So I think this is a tricky one, because the pain can last for a good couple of weeks. And we're talking like pain that you're like, yes, that is painful, and when I move more, it gets worse. Yes. But then I think there's some discomfort that can last for a good chunk of time after. I think that it's just important to keep an eye on that and if your activity is ramping up the pain or discomfort. If you are noticing lots of tension or tightness in the pelvic floor, and that can show up as actual, you know what that feels like in your body. I definitely know what that feels like in my body now. But for some people, it can just be difficulty getting bowel movements out or emptying the bladder or feeling like they're having urge incontinence where they have to go to the bathroom often. For some of my clients, going to the bathroom, either bowel or urinary, is actually painful for them after C-section. That is kind of common and will subside for sure. If it doesn't, things to notice. Yeah, you know what? I didn't go for basically any walks until 5 weeks postpartum.
Wow, okay, yeah.
But I started back to some my Core Plus Floor Restore program, which is some structured, gentle exercise, and actually some strength training, which was very gentle and rehab-based at 4 weeks.
Yeah.
But walking wasn't that as comfortable, actually. And moving my body differently in strength training or resistance type training felt way better on my body after C-section.
That's really good to know, because I think like walking is the kind of thing we just blanket recommend. Oh, start walking, you know. And I remember after my second, walking at about maybe 2 weeks postpartum, you know, you think things are going to snap back together, especially when you have your first baby, I think. But and my hips just felt like they were not attached to my body. And, you know, and it's the strangest thing, you know, you've gone through the pregnancy and your body just changes so quickly, like really, literally overnight when you give birth. And so walking is something that I think I probably recommend without even thinking about it. I'm like, oh, if you feel okay when you walk, walk. But you might not feel okay when you walk even at 4 or 5 weeks, right?
Absolutely. And for me too, I didn't like to walk wearing steel because I always just wanted a break. I always just wanted her off my body at that time. So then navigating the car seat and the stroller, I was like, you know what? I just probably shouldn't be lifting that much right now, to be honest with you. So I didn't. Yeah. And that's okay.
That's awesome, though. You have some stuff on your website that we can look at for postpartum in general. Do you have anything on your website for cesarean section?
Yes, there are some blogs about it. And then I also have a program called Core Plus Floor Restore for C-section. There is a program that is kind of the original that was designed for vaginal births, and now there's a C-section specific program.
A C-section one. That's awesome. Okay.
Yeah, it was born because I needed it myself.
Yeah.
So.
See, it was a message from the universe. Okay.
Yeah, 100%.
Are there any organizations that you know of who are advocating for increased like C-section, awareness, you know, resources? Yeah,
I Can in Canada is a great one. Okay. So they talk about this from both sides, is supporting women through cesareans, and then also giving women more resources to be able to have vaginal births and VBACs if that is what they want, in a safe manner. But again, not putting the pressure on them to be like, you have to have a VBAC. This is the way birth is done. So they kind of support it from all angles, and they're a great organization.
And everyone can reach you at Jessie Mundell, and you've got can you tell me the name of your program again for C-section?
Yeah. So Core Plus Floor Restore for C-section.
Well, thanks, Jessie. I hope the snow melts for like a day or two.